journey and your needs on this crazy fertility uh, challenges. Every day we're living the challenges. And why they're happening, don't know. We do have a little bit of fire here. It's on low. I have the AC on too, so it's a little kind of nuts. But welcome. Going to answer your questions. Kara, Gina, how you doing? Let's see. Pod, Bethany. Hello. Good morning. Good morning. JJ, hello, JJ Patterson. How you doing? Good morning. A beautiful Sunday. It's coming on summer, although it's not summer yet. It's still spring, but we're working on it. Temperatures heated up here in upstate New York, and again, we're here to share some really great ideas and thoughts on improving your fertility live. Let's see, Tahina, how you doing? Instagram, Facebook, we're all here together. I hope you guys can hear me all right. And your questions are welcome. A lot about immunology, inflammation, endometriosis, whether to do surgery or not. Consultant April Dawn, how you doing? We're looking forward to it. It's coming up, 21st, summer. We're all stressing and struggling in this journey, and hopefully that you can gain some knowledge and things that you can improve this journey. I talk a lot about faith, spirituality, meditation, prayer, and slowing it down. I need the work for myself in my life and all the things going on, which are all about helping you guys on this crazy journey. Lee, Jennifer, Tahina, good morning, good morning, good morning. Let's see. Samantha, hello. Let's see. Preservation. You chat about egg quality and preservation in your 30s? Well, preserving your fertility at any age is critical, and keeping inflammation down, reducing the damage that's happening in our body are really critical. The best thing we can do is eliminate the causes of inflammation. Heat is critical. Too high heat is not good, and this is why guys need to keep their testicles cooler. Women have to keep their eggs or ovaries cooler by getting off the treadmill, slowing it down, more walking, light, meditation, prayer is good. Changing diet, look at Kiltz's keto lifestyle. I think that's really, really important. It's one meal a day, maybe a snack, high fat, low to no carbs. And I'm a carnivore. Keto is my recommendation, but I do one meal a day at night. Really helps reduce inflammation in the bowels, which affects the ovaries too. And taking supplements like ovarian bloom, the molecular fertility supplements for men and women, I think can be helpful. But most of all, get away from alcohol, too much coffee, too much tea, and certainly sodas. Eliminate them. Water is the drink, by the way. Let's see. The question on day 11 of my IVF, I feel completely normal and not bloated. Does that mean I won't get a lot of eggs? I'm showing 11 follicles mature. No, that's good. Not feeling bloated is okay in the process. So you don't have to feel bloated in order to know you have a lot of eggs. We can still get plenty of eggs out of all of that. Amanda Lynn, good morning. How you doing? If my progesterone is high and retrieval is Wednesday, it would be best. Yes, the question is, would it be best to freeze the embryos? Over 2, a progesterone on the day of trigger is sort of that gray. It says, yes, you should freeze over 2 or go ahead with a fresh transfer. But we have some that in the 2 to 4 range do okay, but mostly it's 2 or below, transfer okay, 2 or above, then you should freeze. But you talk to the doctor, the clinician that's taking care of you at retrieval, and they can help make that decision for you. Let's see. Ennerlin, Pierre Paul, good morning. Check out the Family Building Guide on Amazon. You can go to our website. We have the Fertile Feast on Amazon, Kiltz's Keto Lifestyle on Amazon, and the Fertile Secret. Lots of good stuff that you can learn from by listening, and go to Facebook, Instagram, and YouTube. You'll see so much in the question answer sessions that you can listen to and learn by sharing this around for sure. Let's see. Wendy Williams, good morning. Let's see. Brittany Witzel, it was a pleasure meeting with you, by the way. And Colorado Springs, thank you to Dr. Banerjee, Dr. Fink. They're out there right now. And And then Dr. Magarelli's taking a few days off, really needed, well-deserved for sure. Ovarian Bloom will be available very soon, Maria. All this COVID craziness, it's just getting enough supplies has been a little bit of a challenge, but it's coming. Omnitrope, what does it do? What is it for? Who should be on it? Kristen, the Omnitrope is for improving egg quality and maybe even egg quantity. So even if you're PCOS or you're not getting good eggs or embryos, but certainly if you have low AMH, diminished ovarian reserve, I think that's where adding the Omnitrope for at least during stem, if not for 2 to 4 weeks prior. I personally don't do the one over a month in use, but it may be valuable. I think that it can be used pre-stem and stem. It can be used for intercourse cycles, IUI cycles, IVF cycles. It may even be helpful for implantation and be used for frozen embryo transfers. So consider adding that and talk to your practitioner about that. Let's see. Lipopo. Let's see. I had 3 FETs so far. Results very low positive betas. That does not rise? What is going wrong? Embryos are implanting but not developing any further. So implantation failure or dysfunction of implantation is very common. The biggest problem is related to some inflammation, chronic or acute, that may be preventing implantation. So this is where we recommend looking at doing an immune treatment, either at least immune 3 or 4. And if you go to our family building guide, there are immune protocols are there. I recommend adding things like Neupogen, Lovenox, 30 to 40 once or twice a day. Prednisone, 10 milligrams to 15 milligrams twice a day. So 20 to 30 milligrams can help with that. And this is where PRP intrauterine can help. And PRP intrauterine, by the way, is not just for people with a thinner lining. It helps with implantation. So PRP intrauterine, HCG intrauterine, and Neupogen intrauterine all may enhance implantation. So those are things to look at, along with the antihistamine, antimicrobial protocols, which is Claritin, Pepcid, and Benadryl, antihistamine, and the antimicrobial Keflex or Levaquin Flagyl with Valtrex and Diflucan. We know there's lots of microorganisms that trying to get us, by the way. Full 30 days in Omnitrope. No, it's not. You don't have to do full 30 days. I do the 2 to 4 weeks. I think that's enough. It doesn't have to be longer than that. It may simply be just on stem. So you don't have to start it with your menstrual cycle. You could start it before your cycle or after your cycle. These are not exact numbers, by the way. Let's see. Rebecca Davis. Hello. Day 12. Consult June 14th. Successful IVF in 18 and no PCOS. Can I start next cycle, which would start June 23rd? You may be able to, but it all depends on our start dates and times to get you into the mix and making sure you get all your medications and all that. Jana Bino, hello. How are you doing? Becky Ann, hello. And thanks for joining us. Let's see. Gabrielle, hello. Consultation Thursday. Looking forward to it. Key. Pleasure. Age limit to conceive naturally. There is no age limit to conceive naturally. I mean, it may be for some people there is into the 50s, but it's rare, and certainly the 60s even rarer. I don't know of any cases in the 70s, 80s, or 90s. But if you're looking for donor egg embryos, we've transferred women in the 60s, and at 65, I feel healthier than ever. We see plenty of women and men in their 50s and 60s are very healthy. So it's absolutely very possible. And but remember, you want to make sure you're taking care of what goes in the mind and the mouth, and that will help the fertile Ferrari be more healthy each and every day. Adjusting goal F to an IUI cycle, Elizabeth. So we do a lot of IUI cycles with going left. I either start at a lower dose at the beginning of the stimulation with the combination of letrozole 5 to 10, going left 50 to 150, depending on your age and your AMH, or starting the gonadotropins after the letrozole. So starting like day 5, 4, 5, or 6 of the letrozole stimulation. And quite often we're using a lower dose, but for so many, they don't do as well without the gonadotropins, and adding them can enhance making a couple of more eggs. If you're in the late 30s, early 40s, getting 4 or 5 eggs and follicles, thus eggs, may be a little bit risky, but sometimes you have to increase that risk in order to get there. Let's see. Morgan Lewis, can I take Omnitrope through pregnancy? Typically, yes, you can take it. Once you start your progesterone, done your transfer, and with the positive pregnancy, then I think to stop it. But it may be earlier. There's no evidence that it's harmful to pregnancy, but just that first implantation, I think it's okay. Cindy Kreider, hello. Vanessa, hello. Nanu, estrogen less than 1,000. Do you recommend doing a dual trigger? We typically under 2,000, it's reasonable to do HCG and Lupron. In the 2,500 to over 3,000, certainly Lupron alone may be beneficial, but for some people, they need a little bit of HCG in the 2,000 to 4,000 range. But quite commonly, we're giving 5,000 plus Lupron 4 milligrams if you're not at high risk of ovarian hyperstimulation. Let's see. Daisha Murray, congratulations. 4 months. Awesome. And there's so many great stories of success, but there's plenty of people who have failed, of having either failed implantation at all or early miscarriages, biochemicals, ectopics. We want to all just continue to have the conversation of what we can all do to make this better when it's failing. And so much I talk about is our molecular fertility supplements. I think they're helpful. Kiltz's keto lifestyle. I talked with Judy Cho, wrote a book, Carnivore Cure, really helpful, great ideas. Marie Emmerich and I have a new book coming out on the Fertile Feast cookbook, kind of limit a little bit what's in there in the science part, but we talk a lot about, hey, what's some good options for eating? I'm pretty boring. Steak, eggs, bacon, eggs, butter, beef, ice cream, and salt. That's my narrow diet. And 1 meal a day. I work on doing that every single day as much as I can. Let's see. Arath 10. How soon should we schedule a consult? Want to start our IVF journey in about a year? I think it's a good idea to get on the books, because once you're in the books, even up to a year, you may not need another follow-up. So if it's in about a year, it's a good idea to get on the books. And you could say, hey, listen, I'd like a consult in 6 months. That would probably be perfect, because then to get your meds and get everything lined up. In the meantime, look at Kiltz's Carnivore and Keto Cure lifestyle and the Fertile Feast. I think it's a game changer, by the way. Let's see. Eggs retrieved from belly versus vagina. What's the difference? Should I get a belly retrieval next time? Couldn't get through on my ovary, a big cyst. Well, we typically go through cysts, so maybe it really wasn't understood clearly. If we can't get to it vaginally, we do go abdominally or through the belly. Dr. Corley is well-versed at doing that. So if for any reason we couldn't get to it, really, really, really rare, if in Syracuse with Corley, Luthringer, and Kiltz, myself, we should be able to do that for you. Let's see. Jasmine Romero, 36. They retrieved 17 eggs. Of those, 9 were fertilized. We decided to do PGS testing. So by day 6, only had 1 embryo made it to freeze. Another egg retrieval. I opt out of PGS testing. Absolutely. I do a day 3. You have to make a blast to go to PGS testing currently. And the ability to blast may be related to the fact that some people just have bad sperm that doesn't allow it to blast, or reasons we don't really understand. So for sure, I'm a big proponent of just making embryos and putting them in. I'm not a big proponent to go to blast. Mrs. Melissima, priming with LDN, Omnitrope, ovarian bloom, prenatals, and keto, 40 AMH 2.23. Do anything else did one cycle, failed implantation, do another cycle, do a stem, add human growth for sure in the stem. But the more you do, the more you get. I do a lot of mini protocols, lower dose protocols. I think those work really nicely. So it might be something to look at, is the lower dose protocols. MFI is our issue, male factor due to really high agglutination after vasectomy reversal. How likely will IUI work without having do IVF? Ginger's girl. So you might use the Zymot. We're talking a lot about the Zymot for both IUI and IVF. It is an add-on. I think it adds on about $200, which may help separate those sperm that are glutenated, and also it may help with those sperm that have high DNA fragmentation. You may not know if they're highly fragmented, but if what you're doing isn't working, it may be we get better quality embryos with the sperm by Zymot. We're going to be putting that in our family building guide. It'll be online where we're sharing ideas and how Zymot may be able to help you. It's another sperm preparation that may be helpful. That girl, 1989, DNA fragmentation 52%. Would we need a sperm donor? No. This is where, again, the molecular fertility for men, along with for guys, low-dose naltrexone, get off the treadmill, look at Kiltz's keto lifestyle, the Fertile Feast, really helpful. I think that the Zymot may be helpful for separating sperm out. Those that are high DNA fragmented, that means 48% of them are not high DNA fragmentation. So that's something we want to find, those sperm there. We know there are sperm there that aren't fragmented and could be helpful. Let's see, Tisha Davis, how subjective is grading of embryos? It's very subjective. It's not very accurate. An embryo is always in motion, and so we might be catching it in a motion where one of the cells is not quite expanded to match the other size cell in the cleaving embryo. So, and even blastocysts really have a lot of different appearances. So my general recommendation is don't rely on grading. It's a beauty contest, and it depends on how much makeup you're putting on and which angle of the camera was on or the lighting. There's so many factors in all of this. Bethany Vellante, Amazon has all my books. They're really a nominal investment. I hope you'll find them helpful. Always looking thoughts and ideas how we can help you on your journey, even without ever coming to us. The idea of the books that we're writing and putting out there, that my team helps put them out with me, is and I have a new book, Living Your Best Life, which is always evolving. But this information is out there. It's really, really valuable. We will be doing retrievals in Atlanta coming up. We're working with Dr. Verdialis and the team down there. It's just taking a little more time than we expected. I apologize for that. A lot of patience. NK cell blood test results show abnormal NKs. I've never transferred or had a miscarriage. What does this mean? Just had a few chances, so doing all we can. I think looking at all these things is helpful. Presimune and Dr. Vidali and I are working. He's been working on this testing to identify whether or not you may be more highly inflamed versus someone else. This is where I think higher doses of prednisone, intralipids, Lovenox, Plaquenil, Neupogen can be very helpful in this process. If you look at our family building guide on Amazon, the family building guide, you look at the immune protocols 1, 2, 3, and 4. I think there's a lot of information there. Infertility, like hypertension, diabetes, cancer, stroke, and all diseases, is caused basically by inflammation. And I believe inflammation is caused by a high plant-based, low-fat diet and eating 3 to 6 meals a day. If you go to 1 meal a day, it doesn't matter what you eat, you might be able to solve your problem. But if you add the fat, coconut oil, hemp seed oil, olive oil, if you're a vegan, if a vegetarian, cream and butter, I think it can be helpful in really lowering inflammation. Kat Bradley, haven't had a period since March. Let's see. Good morning to you, by the way. And yeah, and let's get an ultrasound and blood work to see whether or not you have a thick lining, check a pregnancy test, progesterone, estrogen, prolactin, and thyroid. Those, and look at AMH and FSH levels. I think those things can be very helpful, by the way. Let's see. Any supplements, diet for increasing the chances of a male embryo? Well, the guys, this is where cooling it down and reducing inflammation. But I haven't seen the studies that have shown that one supplement or another may help getting more X sperm or more Y sperm. But that's a good question. If you find something out there, I'm always interested in learn more about it. Caroline, how you doing? Let's see. 10th day of FET and took pregnancy test negative. Tomorrow's beta. We're praying. Listen, you can't rely on those home urine pregnancy tests, by the way. So you have to, I think you still have to rely on the serum test in order to check that out. Samantha, frozen 5-day 4BA transfer last Wednesday. Tomorrow, midways, labs beta on Friday. This is a nerve-wracking process. We all human beings have a nervousness to life, and whether it's to our partners or other people or families or animals, there's an anxiety level that we all carry with us. And some of us are able to sort of hold it at bay a little bit better, or it just happens to be lower naturally. But this anxiety is part of the journey, and we are all working to be better and better and better at it all. Let's see here. Successful FET 3 years ago, had our daughter, awesome, then transferred last year and was successful. A heartbeat by the uterus, bleeds, and had a miscarriage at 9 weeks. Chelsea Fisher. Inflammation. Congratulations on your daughter. Don't give up. You need to reduce inflammation. My opinion, it's all caused by eating like a grazing animal and not like a carnivore animal from time to time. Intermittent feasting, lots of fasting, then eat. No matter what you're eating, that'll help. But if it turns out you're allergic to something you're eating, just cutting back on how frequently you eat may not be enough. But cream and butter, add the fat, really, really, really helpful in all of that. All right. After ERA, Ginger, how long after ERA should you transfer? The next cycle or two, whenever that ERA information is back. We're doing a lot of endometrial receptivity and ERA and ER peak, Cooper genomics versus iGenomics. They all work really great. If you've done one, we'll use it. We're doing a lot of the ERP because it's less expensive. CF carriers, BC, ECI, let's see, CF carriers, do we have to do more genetic testing? Well, if you want to significantly reduce the risk of having a child with CF, then doing PGS testing, PGTA and PGD testing can be helpful, but it's not required. Some people choose not to eliminate a CF child and go ahead and have them. They may live a completely beautiful life, even with the disease, by the way. Let's see, when do you start taking the meds before the IVF process? Coco at Chanel, when the team tells you to start them, you call them, they will let you know. You can message them through the portal, but when you get your cycle, we'll tell you when to start your meds, not before that. You typically, if it's with a menstrual cycle, it may be day 2 to 5 of the cycle, or irrespective of menstrual cycle, you could technically take it any time, by the way. Does a saline sono affect the menstrual cycle? Typically not, Coco Honey. It shouldn't in general, but sometimes it does. Let's see. Let me get where am I at here? Is it okay to stay in ketosis throughout my retrieval and pregnancy? Heather Poole, I think keto is the very best, most amazing thing you can do for life. Kiltz's keto is a lifestyle, pre-pregnancy, pregnancy, and after pregnancy. It's the way to go. It's a game changer, amazing. Most people will not tell you to do it. They'll tell you it's dangerous, but I've been doing it now for 10 years, and it's the very best thing I've ever done in my life. It's made me feel more amazing than ever. I recommend it for everyone. And again, your OB/GYN doctor is going to tell you one thing, but my bet is something else is better. Let's see. Consultation on the 10th. Can we choose to do retrievals sometime in October? Caitlin Townsend, yes, absolutely. Whenever you guys are ready, let us know what time you're thinking. Talisha, fresh transfer, even though my pre-retrieval labs show premature elevation. However, labs and uterine lining looked right on track. And a monitoring appointment yesterday. Again, your decision to transfer or not, we will make our recommendations. We will highly recommend to do it or not to do it, but we want you to know that you're in charge. Obviously, if it's significant risk where we think it's like, do not do this, we're going to really help you make that right decision. Bleeds caused the miscarriage. Chelsea Fisher. The bleed did not cause the miscarriage. The inflammation caused the miscarriage. It caused the separation of the placenta. It caused the bleeding. This is why kiltz's keto lifestyle, when you're pregnant, stay on it. 1 meal a day. Go fasting longer. Reduces glucose and glycation. Glycation damages the glycocalyx, which is a very important structure that helps keep the placenta and the endometrium and the uterine together. How do you know you have inflammation? Do you have do have meds to take for that? Yes. Look at kiltz, the CNY Fertility Family Building Guide on Amazon. There's lots of really great information there about inflammation. Inflammation is the cause of disease. Inflammation, it reduces the function of the flow of blood flow. It causes the inflammatory cells of the body, the NK cells, the platelets, and all the immune cells to attack the pathogen, but it's attacking the cells that are damaged at the same time. That's the challenging part to this. But if you look at our Amazon, look at our Family Building Guide, kiltz's Keto Lifestyle has a lot there to help you with that. Can people with PCOS who have had failed IVF and commit to keto increase their odds of conceiving naturally? Laura C. Brooker, yes. But the most amazing thing, look at Ken. Well, let's see. Who am I thinking about? My brain is on. Look, Maria Emmerich. I just talked to Judy Cho. Look at her on keto. Lots of stuff out there on reducing inflammation, especially in our Family Building Guide and kiltz's Keto Lifestyle. PCOS, and take ovasitol and inositol, I think are helpful. I'm not a big fan of metformin. Ken Berry, Ken's last name. Sorry, Ken Anisha Berry. Check out his channel, YouTube. Ken's just doing an awesome job as a primary care physician. He's primarily sharing ways that you can improve your fertility journey and health and wellness overall. Polycystic ovarian syndrome is a pre-diabetic metabolic disorder. Many women go on to get diabetes. I think there's a metabolic disorder, similar PCOS, in men also. Glucose is the killer, not insulin. High glucose causes glycation. It causes high insulin that we blame insulin for the cause of damage. But my bet is it's strictly glucose. InvoCell lab. We've done InvoCell, but we're as inexpensive without it. And I think it's a little bit better without it, but it's just another option for you guys. Let's see. Amber, serious question. What cause a positive pregnancy test during stims? Does gonal or menopause cause? There are some things in the body that cross-react with the testing. But if you're on low-dose HCG, that can also do that. But high LH and FSH may cause that a little bit in some assays. Having really bad seasonal allergies, Ginger, I'm assuming that's it. This is where when I eliminate fruits and vegetables from my diet, that's when all the inflammation went away. I stopped using Claritin and all those other things, and I felt better than ever before. Terrible allergies for years, bowel bleeding, arthritis, psoriasis, kidney stones, and migraines all went away when I simply went to kiltz's Keto Lifestyle. Check it out. It's amazing. Miscarriage to do another transfer, 4 to 8 weeks is probably enough. Follow the HCG down, get a normal menstrual cycle. If you get regular cycles, if not, we can go from there. But if you've had a miscarriage, this is where we want to make sure we're either looking at causes or adding more things like our antimicrobial, antifungal, antimicrobial, antihistamine, and anti-endometriosis. By the way, the Receptiva DX, which is an endometrial biopsy that may identify inflammation and endometriosis, may be helpful if you're on the fence of whether to do a laparoscopy for endo or not, or simply take the 2 months of Orilissa and letrozole, which is the medical treatment for endometriosis, can be really, really helpful. Kara Michelle, how you doing? How can you do a day 3 fresh transfer? ERA showed I need an extra day of progesterone. Well, we start your progesterone a day early. Remember, it's a frozen embryo transfer, not a fresh transfer for ERA testing. So it's only good for frozen embryo transfers. All right, Brittany. ERA showed pre-receptive. Now looks like we might have to change protocol based on NK cell blood results. Should I do another ERA? Typically, I think the ERA or ER peak, I don't modulate based on all the immune stuff. I modulate based on estrogen, progesterone, or trigger timing. That's it. The immune stuff, I don't approach it as if it affects the timing personally, but it might. Again, it may be, it's just that inflammation which affects all of that. Fresh versus frozen eggs success rate. I think they both work great. I like to use fresh eggs, make embryos, then freeze the embryos, and then get scheduled for the transfer and all that. Carolina Cejas de Molina, thank you. Nicole Reardon, hello. Let's see. Mrs. Gina Hester. Dr. Banerjee to take it. Let's see. And listen, you don't have to do PGS testing. Age doesn't mean you have to do it. My bias is make embryos and put them in the uterus. If any of our doctors said you should or have to, we are not. That's not true. You choose to add it on if you want. My belief is inflammation causes egg abnormalities, sperm abnormalities, and thus embryo abnormalities, which can cause failed implantation or miscarriages. Let's see. Kiltzes, KILTZS. But, maybe it's kick-ass keto. I should make it. It's Kiltz's Keto Lifestyle is the name of the book on Amazon. It's not proprietary. You can use anything you want from it. Share it as if it's yours, please. It's a crazy concept, but I believe that in modern medicine, we're still recommending the wrong diet for a human animal. We are domesticated carnivores. So are dogs and cats, domesticated carnivores, which are eating mostly a little bit of lean meat, lots of vegetables, seeds, nuts, beans, legumes, which we're not herbivores. Let's see. Ziza, high BMI, keto for 3 months, weight loss slow. Be patient. Do you have any success stories? High BMIs all day long. We do not eliminate your BMI. And Buffalo doctors, we're working on the anesthesiologist to ratchet up the BMI because plenty of women with higher BMIs have babies all day long. Light sedation, very safe. That's the key here. Why do you need to take birth control pill for IVF? Janelle Katz, I don't recommend. Dr. Chang, stop using birth control pills. Estrogen, progesterone, or prometrium if you need it. I don't like it in general. I would say just start with your cycle, but if it's timing or something, estrogen, progesterone can be used. I know we all do a lot of different things on this journey, all our doctors and practitioners. We're all working to sort of line it up in a similar fashion together. Let's see. Babo, transfer is lower success rate than frozen. Fresh transfer is lower success than frozen. I don't think it is. Repeat do I need to repeat HSG if I did IVF, if I did 5 years ago for IVF? You don't have to repeat the HSG or saline sonogram, but if you don't do it and then later on we find something, it's like, oh, why didn't we do that? So that's kind of the rationale for doing all of that, by the way. You guys hear me okay? You guys having a good time? Thanks very much for being here today and joining me. The Fertile Fireside Chat, Dr. Rob Kiltz. Let's see, Dr. Condrup with us this last few weeks. He's going to be taking over in our Sarasota office, opening up hopefully July, August for monitoring and consults, HSGs and surgeries at Doctors Hospital. We'll be working with your OBGYNs in the Sarasota, Tampa, St. Pete's, Miami, Orlando, Jacksonville, all over in Florida. So we're really excited about that. Hopefully starting IVF retrievals and transfers, probably September, October through December. So I'm not exact, but we're going to really be working on that, probably getting that going before Atlanta. But we're working on that with Dr. Verdialis and hoping to get that going quickly. They told me I probably had chemical pregnancy miscarriage because I didn't get the embryo tested. Well, not true. I'm sorry about that one. I am Tika Moore. Doing an embryo testing doesn't prevent a miscarriage, by the way. In my opinion, doesn't matter. My doctors, I'm really trying to slow them down on the number of telling people you need to get tested embryos. Plenty of untested embryos make normal babies. Plenty of normal tested embryos miscarry or don't implant. I think the testing is not accurate enough. We still support it. You want to do it. We do a lot of it. But if you think that that's the answer, my friend, it is not. So PGS testing, I think, it needs to be reassessed. If you have a lot of embryos and you're trying to limit the number of embryos to transfer, then I think it's reasonable. If you have a known genetic disorder, yes. Or if you have a translocation, yes. That's where I think they matter. But PGS testing does not significantly change the chance that embryo is going to make it or not, in my opinion. Super Freshy, how you doing? 40 years young, miscarriage at 8 weeks, transferred 2-day 3 morulas. Should I transfer 3-day 3s next time? Yes, for sure. But look at the Immune 4 protocol. Start it at least 4 weeks prior to transfer. IVIG, Humira, Plaquenil, Neupogen, Lovenox, aspirin, and higher dose prednisone. My team, the 5 milligrams twice a day needs to be bumped up to 10 milligrams twice a day, at least for those with poor implantation, miscarriages. I think it's really, really, really important. Reminding us, patient, ultimately our journey. You're in charge. Talisha, thank you. Low AMH mean for me at 40. Will IUI work? IUI, IVF, natural can all work no matter what your numbers are. But if you do nothing, you're thinking you could just do the number and it says, oh, it's going to work or not going to work. There's nothing 100% in any of this stuff. So that's really important to recognize. Nothing 100%. Have faith. Remember, faith over facts, spirit over science, whether you're religious or not, atheist, agnostic, or theist. Just pick some belief system to focus on every day. I wrote a book called The Fertile Secret years ago, Mind, Body, Smile. I practice it every day to share how we can all be better in sharing positivity and love and kindness. We all get a little tweaked from time to time, or down and depressed, anxious, or mad. That's natural. We judge from time to time. We're human beings, but we want to practice on pulling ourselves back out of the craziness and helping each other. But we don't know the numbers that work or don't work. Plenty of people we've never tested, people go like, wow, how did that happen? It happens. Nikki, new IVF journey, had 2 ruptured ectopic pregnancies, same tube, was told that is not safe for me to try again, but they kept my left tube HSG between ectopics, and that came out clear with the current clinic recommendation for me to get my tube removed before starting. If you have an open tube, don't remove it. Plenty of women have babies after 2 ruptured ectopics, and keep trying and doing. Listen, if you don't risk having a baby, you're never going to get pregnant, right? It's like, oh, they told you it's too dangerous. I mean, driving a car is dangerous. Look at everyone driving a car. Crazy, right? We will absolutely pray with you, by the way. Any of us doctors will be willing to take a moment of prayer, of a spiritual faith, whatever you desire, we're there to be with you for sure. Let's see, 39 AMH normal, tubes open, and no underlying health conditions. Golden 1XO. I've had 2 failed IUIs. Should I move to a mini IVF? The most eggs I produce per month is 10 per transvaginal. So I do a lot of mini protocols, lower dose protocols. All right, lower dose. I recommend it highly. 10 of letrozole, 200 of gonal follistim, and low-dose HCG, 20 or 150 gonal or follistim with Menopur 75. I think it's really, really, really good. And a gratitude to all my staff and team members for all the amazing care that you guys are showing to our clients. They are in need of our support, kindness, and love. We need to be better at that every single day. So let's keep going. Georgia's son, absolutely. Is it common for patients to bring babies to meet the doctors after being born? Absolutely. But this crazy COVID, we're holding off on our zoo party again this year. Maybe we'll get it going in 2022, but we want to celebrate every single day and send the pics in, share them on our Instagram and TikTok, and let's see, stitch the videos together, right? Stitch this, which I'm trying to learn all this lingo. I'm not very good at it yet, but Hannah has been trying to teach me and get me in line with that. And I got a chance to see my daughter Pilar after like a year plus because of COVID. It was really great to spend some time with her. So sometimes we all need to step back from what we're doing in our work world to spend some time in our personal world. And so I too needed some time to turn my phone off, spend some time with Miss Tia and Miss Pilar, and our families and friends are really important. So turn off the phones, and Tia's always reminding me, turn it off. Jerry, Jarrett, how you doing? A pleasure. Keep sharing your stories, by the way. We need your video stories on Instagram, Facebook, YouTube, Snapchat. The more we can weave them all together, stitch them together, bring them in. We're going to be doing some in-house full video stories about your journey. Please, hey, can I video this journey? Your monitoring, your preparation, all these things. We want to share them all the way around. Completely made my egg retrieval on Wednesday. Olivia, Nurse Sarah, both Sarah G and Sarah S were grateful to all of them. Panic attack before I went under, and she was absolutely an angel. Awesome. Let's see. Coco Chanel, a vasectomy is having surgery to give me sperm for IVF. Will his sperm be good or need to get it? We do a lot of sperm freezing. People drive to Syracuse with Dr. Trussell to do an aspiration and freeze. But our docs, they're working with urologists around the country who can do a aspiration or an open biopsy to freeze your sperm, ship it to one of our locations in order to help you on that journey. Somewhere we can send a compliment to Nurse Tricia here in Rochester. Just send it to our kiltz at CMI Fertility. Put it on our website. Please, we are so grateful, or send it in your portal. We have all of our team members. We're really grateful. This is a hard journey even for them. Sometimes we all have our personal stuff that we bring, and we're all working to listen and learn better. So if at any time we seem to be insensitive or not doing it right, please accept our apologies. We're working every single day to be better. JK, I'm so sorry about losing your daughter. My belief is it's all inflammation. It's all about, look at Kiltz's Keto Lifestyle, Family Building Guide, Game Changer, The Fertile Feast. My belief is a high plant-based grazing animal diet is deadly for us. It's the game changer, the thing that is killing us. It's killing our reproduction. I'm sorry. And you can do natural IUI, IVF, but remember, faith over facts, spirit over science. They really weave together, actually. It's all somewhat judgmental to our invention of our belief system in our brains. Our brains are the creators, creates our anxiety, our fear and worry. We all get that way from time to time. I have to tell Tia, sometimes I'm a little too needy, and maybe even to my daughter and to my team members. But sometimes we all need to step back and thank you, God, Lord, creator, nature, sun gods, whatever it is, find some gratitude and keep going and don't give up. Skip IUI. Let's see. I have endometriosis. How can I improve my chance of IVF? So this is where, if you haven't done the laparoscopy, hysteroscopy, excision, vaporization of endo, if you haven't looked at potentially doing Orlissa or Lupron for 2 months, plus letrozole, 5 milligrams, very helpful. And of course, by the way, I believe that endo is a bowel disorder. It all stems from inflammation in the bowels and the bucket. By reducing inflammation in the bowels and the bucket will significantly reduce inflammation in the pelvis, which damages, guess what? The prostate, the testicles, the sperm, the ovaries, the eggs, the uterus, the tubes, the everything. It's a game changer. Let's see, Olivia, the nurses at the front desk, Dr. Luther, all, I have amazing team. And for any reason, if you feel as if you didn't get our very best, please let us know. Give us another chance to come back and give you a better experience. Sometimes when you're under anesthesia and you're waking up and things seem disarrayed, there's a surgical approach too and all this, that we're really trying to do our very, very, very best for you, by the way. Let's see, Bethany Valente, it's my pleasure. Blessed Sunday. Every single day, find joy and happiness, even in the troubles and the challenges. We all get that and feel that from time to time. It's our crazy nature. And I apologize if I kind of tweak others in my day in any way, always trying to be the very best. All right. Wow. Let's see. Giselle Valdez, a pleasure. Let's see. But my follicles aren't growing. Sometimes it takes more patience. Sometimes it takes upping the dose. But really, sometimes some people have to go longer. Sometimes, again, you may up the dose, but you have to be careful. If you double the dose, you may overstimulate and go too fast. So I usually recommend start at a dose and stay at a dose. And you just got to be patient in the 5 to day 10 of stim level. Which meds to take with food? Cindy Kreider. Well, the shots, obviously, I don't think they matter. But my bet is I don't know that it matters so much. You individually have to figure out what works for you. But I think all of the meds can be taken without food. I think all this take food stuff is maybe pushing us to take too much food. Less food. Again, Giselle, it may be changed, but again, let's see if they're only 10 millimeters, it may be up the dose for sure. And talk to the practitioners who will help you with that. I think that's important. AMH 3.4 mini. I do a lot of minis pretty much no matter what your AMH level is. I think that mini dose helps if you're a high responder, a low responder, a medium responder. I do that a lot. And for me, it's 10, 220, 10 of letrozole, 200 of gonal, and 20 of low-dose HCG, or 150, 75 gonal Manipure. I think it works very nice. And then 150, it could be 125 plus 75. It works really good. Don't forget low-dose naltrexone, LDN. It's in our family building guide. I have a new family building guide coming out, new, and we're going to pack it with some more recipes. I'm talking more about the glycocalyx and how the damage of the glycocalyx by glucose, which is a high plant-based diet. Remember, all vegetables, they break down to simple sugar in the bucket. Remember, this is the bucket. The bucket is necessary to break down the food into the simple components to get them into the hepatic portal system in order to make fat from proteins and amino acids. If you eat fat, it doesn't go to the liver. It goes directly into the lymphatics and it's distributed everywhere. And my bet is glucose is not the fuel for the brain or the muscles. Basically, we always burn fat, never sugar. And keto is not the conversion of sugar to burning fat. Keto just means it's a low glucose environment. 2 months, TSH before was 2.5, 1.4. Again, inflammation from the plant antigens, the plant chemicals, the glucose and sugar, and the fermentation of the fiber in the GI tract is the cause of all the damage and disease. And basically, we're eating the wrong diet, my friends. It's a game changer in that reduction in inflammation will improve the blood flow at the microvascular level. 98% of our vessels are microvessels. They're not the macro stuff. And inflammation due to glucose, the antigens, the phytochemicals, and the alcohol, aldehydes, and methane that are floating through your bloodstream is the problem and the cause. Let's see. Talisha, let's see. Not such a great experience. Advocated for ourselves. And remember, let's see, please be faithful, hopeful. And sometimes it's like, hey, I don't understand. Can you please help me better understand what you're saying? I'm working on our team members that are calling you. Let's all be patient and listen to what you guys have to say. The more you guys tell us what you need, we can do better, and we want to do better. Again, our Atlanta team. Oh, Dr. Ivanov in Philadelphia. We're really excited about the Gennady Ivanov in Philadelphia satellite monitoring office, just like our Atlanta office in Monroe, Georgia, where Dr. V and the team is doing monitoring. Really helpful. We're working to get Saturdays open down there, and also Saturdays in Philadelphia eventually. Let's see. Courtney Scarpino, only either LDN or prednisone at night makes my stomach hurt. Take it in the morning, or the prenatal supplements through CNY. Reward myself with 1 Starbucks. That's okay. A little bit of something. I don't know. Take it down with the good water. I don't do coffee now. Maybe I'll get back eventually, and get rid of alcohol. It's not good for your eggs or sperm or embryos. Slow it down. And drugs, listen, we can be in a drug-free life in so many ways. From time to time, the pharmaceuticals are good and important, but what we want to do is lots of fresh air. And this is where meditation, prayer, and slowing it down. Take a walk in nature. Get on your kayak or paddleboard and go slow and easy. That's really, really, really important to me, how we can do better to take care of the Ferrari, the fertile Ferrari, the lioness and the lion. The better we slow it down. Use what you put in the mind and the mouth is critical to all of this. Let's see. I'm on day 16 of Stimson of PCOS at 30 eggs on each ovary 2 weeks ago and only 4 above 10. Then the leading ones disappeared, and now I have 5 new ones, 11. And Courtney, this is where potentially ovarian drilling, ovarian acupuncture can be helpful, and even a higher dose, or start higher and then drop it down. You might start at the 400 or 600, and then drop it down to the 200 to 300. A PCOS, where those that really have a high MH and lots of small follicles can benefit from a high dose and a low dose. But most of the time, start low and stay low. Go longer, be patient. I think that's important. Positive ANA. What do I need for retrieval and transfer? This is where immune 3 or 4. The prednisone, 10 to 15 twice a day. The Lovenox, start early. Aspirin, 100 milligrams, not the 81 milligrams. And this is where Plaquenil and Neupogen, I think, can be really, really helpful. NA, ACA, lupus, inflammation. And my opinion is it's all about inflammation. That's the leading problem. Let's see. Bethany Vellante, God bless you. Every single day, God is brought into our lives for a reason. And we need to see God in everything, even our problems, our fears, our worries, our anxiety. He or she or it or whatever you label it is there to guide us. Oh, LGBTQ month. This is a month for all of us to recognize we need to take care of everyone, whether you're gay or lesbian, transgender, or in the flow of whatever you believe. At CNY Fertility, we're here to take care of you. We need to honor each and every human being, no matter their size, shape, age, weight, color, gender description, relationship description. We need to make sure that we see God in everyone. And we all get tweaked. It's our nature. Let's better practice being loving, kind, and generous to the person in the mirror and everyone that's created within our minds in our lives, by the way. 220 and LHHCG, Talisha, let's see, when will I find out immune protocol need? In my opinion, we're doing a lot of level 3s. If you really have a lot of immune problems that you know about, where you have psoriasis, you have Sjogren's, you have irritable bowel colitis, that may be the level 4. Humira and IVIG can be really, really helpful. Let's see, CBAVD. Let's see, DESA. What should I do prior to my consultation? June. Read our family building guide, kiltz Keto Lifestyle, the Fertile Feast. Read the Fertile Secret, all of those. Oh, the Fertile Spirit, where we're offering phone or video chat for people that are feeling down and depressed over this process. Danielle and her team can really help you in the process, bring about ways to improve on how you're feeling. And all of us have feelings, right? We sometimes get down and depressed too. Sometimes we don't even know what it is. The time of day, day of the month, don't know what it is, but all of it is truth and reality or humanness. And this is where we got to change what we're thinking to change the environment that we're living. You can skip IUI and go straight to IVF for sure. J.K. Galen. Let's see. You can send compliment again. Thank you very much for all your thoughts and words. It's normal to start with follicles on your baseline. Yes, you don't have to have 0 follicles or small follicles. You can even have cysts and big follicles. Technically, you could start any time of the cycle. This idea that it has to be bunch of little follicles with cysts or endometriomas or hemorrhagic cysts, all good. What do you prefer, full or empty bladder? Cowgirl, yeehaw. I do recommend a full bladder because abdominal ultrasounds do better with a full bladder. You guys doing okay today? It's Sunday. It's my day of rest. And this is part of my rest, by the way. I really enjoy this conversation. I'm learning every day. Do some artwork, painting, pottery, poetry. Go for a nice walk in nature, a kayak or paddleboard. Go sailing. Find something in your day, in your life that makes you feel like you're connecting with life and nature. And for me, spirituality is really important. I found Christian philosophy, but I look at all of it. Islam, Hinduism, Judaism, Buddhism, all of these things, and whatever religion or non-religion you bring to the day, bring a more positive outlook and know that all things tomorrow will work out the way they're supposed to. Everything yesterday happened the way it's supposed to. And it's good to talk about your feelings and ideas and thoughts and how you're feeling, but recognize these are all constructs of our invented brain and our experience of yesterday. Every day. Thank you, God, Lord, Creator, for this day. Thank you for giving me this beautiful life. And thank you guys for joining me this day. Again, go slow, enjoy the day. See you next Sunday for sure. I may be taking some time off with Miss Tia next Sunday. We'll see. Maybe I'll have a stand-in for Kiltz's Fertile Fireside Chat. Check out all of our lives coming on this week. Again, share your videos, your stories. We really, really appreciate them. And when things aren't working right, let us know, please. We can do better, all of us together. God bless. Enjoy this day, Dr. Rob Kiltz. See you guys.